Hi, I'm Olga Zayts. I grew up in Russia, so I'm from a beautiful place called St. Petersburg, and I've been in Hong Kong for the last 17 years. I direct Research and Impact Initiative for Communication Healthcare, Hong Kong RIICH, and I work very closely with people in the arts faculty, social sciences, medicine, also medical institutions and healthcare institutions in Hong Kong, and NGOs and patient groups. We are starting a couple of new projects related to COVID-19. Both of them resonate with me quite closely. So the first one is on working women. And there is reference in this research to COVID as gendered crisis. And myself, with my 3 kids, I've been affected big time because your employers expect you to work as if you don't have children, but then your children want you to pay them enough attention as if you don't work. And this is a conundrum for many, many women. So we've started a project where we looked at 2 types of data. The first one, surveys with working women, and we've asked them general questions about their mental health, but also how they manage this life-work balance. The second type of data is, again, something that I've been doing for years and years and years. So I'm on several fora for women. So we've looked at Hong Kong moms and how these women responded to COVID, and the messages that they posted related to COVID, and the messages are about school closures, the messages about wearing masks, and their mental health, and so on and so forth. From end of January 2020, this is when schools first closed in Hong Kong, until mid-May 2020. I'm very excited about this project because I think a lot of the findings will be very practical and very relevant, and potentially we want to take them to public policy funding bodies in Hong Kong to say, look, women are one of the most vulnerable demographic groups in the workplace as they are. But in crisis times, you do need to pay a little bit more attention, and you do need to sort out this kind of work-life balance and allow these women to be good employees, which they are, but also allow them to be good mothers and good wives and good partners. These are people who are well known in the field and can really engage in impactful research. So there are several projects that we've been discussing on end-of-life care, on mental health as it happens, on development of various apps, on telemedicine. And you could do a lot of work as an individual, but to have the support of the rest of the consortium is absolutely fabulous. So that support can be in applying for funding applications. That support can be intellectual, where you could bounce your ideas back and forth and really engage with very close conversation with top people in the field. Any group that you take, whether it's a group here in Hong Kong or a group in Australia or the group in NTU, you've got people leading the initiative, and these are very well-known people in the field, but then you've got other people who are working with them. So it's kind of like a group of people that includes very senior, well-established scholars, but also younger scholars, and you can see the continuity of that initiative. We're starting something that our students can then take forward and hopefully move the field as well, and that's very exciting.